For the second day in a row, there are fewer than 200 new cases of COVID-19 in BC. Our active cases have now dropped to less than 2,300, the lowest that number has been since October 31st. Although the number of cases is encouraging at 194, there are also 4 new deaths, bringing the province's death toll to 707. Hospitalizations are also down to 246, with 70 patients in intensive care. 61.3% of BC's population has now been vaccinated, but only just over 200,000 of those are second doses.
Even though cases are down, experts are still calling for caution when it comes to COVID-19. That's because the same variant that's driving the third wave in the UK is also rising in BC. CTV's Penny Daflos reports on whether it could impact our reopening plans.
The United Kingdom distributed first doses of COVID vaccines earlier than Canada, but is now entering its third wave. The strain first discovered in India, newly named the Delta variant, is now threatening the UK's reopening plans. Delta is more contagious and also growing in BC, the only type of COVID that didn't decrease during the circuit breaker restrictions.
It's looking to be ramping up, and of course with reopening, then that would be even worse.
The independent data scientists and researchers in the BC COVID-19 modeling group warn that step 1 of our reopening could see a small uptick in cases, but they're more worried about what the wildcard Delta variant could mean in the longer term.
We will only be able to safely open up as these new variants appear around the world. We'll only have insurance against them if a very large fraction of our population is vaccinated. It just makes a big buffer. It makes it harder for the disease to spread.
Right now, only British Columbians 80 plus are vaccinated at the levels the modeling group says are needed. They insist all ages need to get to about 85% with 2 doses to stop the variants in their tracks.
That's why our opening is not based solely on immunization. It's based on looking at whether the measures that we have in place are continuing to work.
BC's top doctor recognizes the risk of the Delta variant and is going back to scrutinizing every positive COVID test rather than random testing to see exactly what is circulating.
And this is going to be more and more important as our numbers continue to go down and as people start to be more mobile and travel more.
A lot depends on vaccinations, with 2 doses providing the best protection available.
If not enough people opt for the vaccine, we'll likely keep seeing clusters and outbreaks that could impact reopening and our return to normal, prolonging the pandemic even more. Penny Daflos, CTV News, Vancouver.